disabilities, the top ones that we have right now between the ages, like kindergarten, first and second grade, they're being diagnosed with ODD, which is operational defiant disorder. So it's those kids that don't want to ever do anything. They're always telling you no, they're not motivated. We have ADHD, dyslexia, and autism. And autism is like the hot topic right now in the world that everybody wants to talk about. And then we also have the most common disabilities that are in kids that are ranging from 2.5 years old until teenage is ADHD, anxiety, and behavioral disorders. So some of the behavioral disorders, it goes back to the ODD, ADHD, and autism. We're also going to talk about girls versus boys. I know that, the Muslims, we never want to talk about mental health because it's like looked down upon, or if you come from a certain culture, don't talk about it, it's a gym position, or no, it's not in my family, nobody in my family has it. And so I feel like we all have to start with having the notion that having a mental disability is okay, And so I'll just talk about girls usually are diagnosed with anxiety, and they have higher anxiety, depression, or eating disorders. Depression are sometimes led by, hormonal imbalance in females, or also depression is also led with narcissistic abuse, and that's along with anxiety. And then for boys, we have ADHD, behavioral, and suicide. And I know like the Sheikh Ahmed can talk about, this past year we've had an increase in suicide here in the Muslim community, and nobody wants to talk about it. So I just feel like having that transition from high school going to college is usually where we see that huge gap of suicide rates. And working for the state, there has been an increase of 57% of suicide rate from 2020 until today, which that is a huge number. We also are going to talk about that 1 out of 25 are diagnosed with suicide, schizophrenia, bipolar, and major depression. So with that, once we're able to recognize that someone has a mental disability, we want to be able to diagnose them. Now a lot of schools are doing a lot of assessments, so you can get diagnosed or referral in school. You also can get that from your local doctor. Growing up in a Middle Eastern family, I know that it's one of those like, oh, don't talk about it, brush it underneath, you'll get out of it. And I just feel like in this field that I'm in right now, I'm seeing a huge increase in smaller children with autism especially. And so like my youngest client is 2.5 years old that got diagnosed with autism. And so I always tell parents, it's better to get the diagnosis early so then they can get the resources than to get it later on in life. Because usually by then it's very hard to get out of those behaviors. Boys are more likely to get it than girls 4 times in autism. And then we also say that it's better to catch it younger in life than later on. And so one thing that we do here in the state of Indiana, there is